to salvage the situation and possibly retain the man in the country. Kenyatta University Teaching and Referral Hospital Board chairperson Olive Mugenda now wants Kenyans to stop seeking treatment outside after the operationalization of the multi-billion facility in August. Speaking today when Kenyatta University, through the contractor, handed over the project to the national government through the board members, Mugenda said it will be cheaper to be treated at the facility, which has been equipped with modern medical facilities, saying that the facility will reduce medical tourism.
So the process that we are going to have is from June, we are going to recruit. We will start recruiting the senior officers, the heads of department, the directors. After that, we are going to recruit the rest of the staff, the personnel who are going to be working in the hospital. And therefore, by the end of July, we should have a critical mass of people hired so that we can start operating. We are going to hire our own doctors so that, again, will be advertised. And I would like to say here that we have seen a lot of advertisements in the social media, and those are, I don't know whether to call them fake advertisements. We are going to advertise now from today. So we are going to be hiring, and our aim is to open the hospital in the middle of August. Yeah. It's a specialized hospital. I would like to emphasize what the minister said the other time, our CS, that it will be a referral hospital only. So it will be a referral hospital and also a specialized hospital. So we'll be able to deal with all kinds of diseases and on referral basis. I think that is important because then we are able to really help Kenyans who are suffering from those diseases, and hopefully the day-to-day walk-ins can be handled by the county hospitals and other facilities. Then we only come in as a referral facility. The impact of the hospital to Kenya as a country, I think, is great. As you know, one of the president's agenda is healthcare, provision for all. I think we are playing that role very well because in addition to adding the number of referral hospitals in Kenya, we are also going to do exactly that, provide quality healthcare for Kenyans. So the impact is big, especially this idea of traveling to other countries to seek treatment. Because you see, it's not just treatment, but then you also have to go there, get a place to stay, and you need your family around you when you are sick. So we want to deal with that. But the way to deal with that is, because the reason why people go out is for to get good doctors and equipment. If we can deal with those, make sure that we have high quality doctors here. And Kenyans, we have very good doctors. But then we also make sure that we have the right equipment. Then we will solve the problem of people going out. And that is our aim.
I have a neighbor whose wife is in another country going through treatment. And he was telling us that in one of those countries, there are so many Kenyans that on Sundays they hold a church service. And most interesting was that the church service would be held in vernacular. There are so many from this part of Kenya that they would hold a church service in another continent in vernacular. And they are all there for just one reason: seeking medical treatment. That knowledge is available to us. The equipment is now available to us. We have been told that it's taken 2 years. It cannot take any longer. Today, in many parts of this country, people will be diagnosed with cancer, with acute TB, with so many other very complicated diseases. We cannot, Professor Mugenda, you are known for being a hard worker. You are known for being a visionary leader. Please be the visionary leader here. Take the shortest possible time to open the gates of this facility to patients. And that will be a contribution to the welfare of this country. I also want to pledge that my office, the office of the head of public service, will be available for the board, for any guidance, for any support at any hour of the day.
The board is looking forward to engage both regional and global partners to strengthen the operations of the hospital and make them at par with the world-class standards. We did this when we wrote the proposal. We did this when we are constructing. We visited many world-class hospitals in the world to make sure that we are at par. But still, we need the partners to make sure that even the processes and the systems also are world class. I would like to say that already we have an offer from a partner who is willing to come and help us set up the breast cancer center. And I think we should clap for that, because most likely it will be the first breast cancer center in Kenya. And you can see partners are coming, they are willing to put in money, they are willing to make it world class. So we look forward for more partners to come on board and really help us make sure that this will be a great center of excellence in our country.
Hospital, it's built within 100 acres. It has a state-of-the-art facilities, as the contractor has said. It has various flagships. One of the biggest flagships is in the oncology department, where we have a linear accelerator machine. That's an equipment which goes a long way in treating patients who have cancer. It also has a 21-bed ICU, again state-of-the-art, complete with a HDU, a 10-bed HDU. It has state-of-the-art newborn units. So we really appreciate the work you've done, and we want to assure you that we will put it to good use so that the patients can benefit from why it was put up.
We are very, very happy that this is taking place. The facility is supposed to take both clinical and teaching. And therefore, we are really looking forward to the day when we see patients being serviced, and also our medical school, our university, being able to use the facility for training our members of staff who are expected to actually address the medical issues, not only for Nairobi as a county, but the 47 counties that really seriously need people who are qualified.